Respected chairpersons and dear delegates, good afternoon. I'm not supposed to speak now today actually, but I'm like an upma, you know. If everything is over during a marriage, the easy thing to make is upma to feed people. So I'm just like that. I'm coming because my friend Dr. Jayaprakash, I did not make it. I'm coming in there. You know upma? You don't know? Okay. Upma is something like a khichdi, which is easy to make. So even upma will take some time to make, I think. I know. Yeah, it has come. Upma has come. Upma has come now. Okay. See, I mean, we all having a problem, you know. There are a lot of vitamins in the market, and then every day, I'm sure a lot of you are facing that, you know. Use this vitamin, it will be very nice. This vitamin, like nice, like that. But what is exactly the role of vitamins in management of diabetes? Is it really useful or it is not useful? Let us look into that in a very practical and pragmatic way. Now, what exactly, you know, see, the reason why we also need to know is a balanced diet is that it should have a balance, it should have all the vitamins within that. So it is just called as balanced diet is the one which contains the qualities and proportion of nutrients that includes vitamins and minerals needed to maintain good health and sustain life. That's one. What is nutrition supplement, that is vitamins and minerals, is that is a preparation intended to supplement the diet and provide nutrients such as vitamins, minerals, fiber, fatty acids, amino acids that may be missing. You see that red letters. May be missing. If they're not missing, don't use it. May be missing or may not be consumed in sufficient quantities in a person's diet. So if you have a balanced diet, if you have everything, you don't need to supplement. That's what it means actually. So those people who are deficient, yes, you can think about that. Now, is there any rationale for using these supplements beyond these definitions? We can see that because of a recommended dietary program, like, you know, we say that low fat diet. So fat soluble vitamins may be low, and you are on a fluid restriction. Even water soluble vitamins may be low. We don't know about that. So in diabetic patient, because a recommended dietary program, diabetes patient may become deficient in a few essential micronutrients, and then a diabetic patient, because of metabolic abnormalities, there is a possibility of reduced absorption and increased excretion of the vitamins which are given through food. So like gastroparesis. No, it can happen actually. So there can be lack of absorption and there is an increased excretion as well, is a possibility that can happen. And then if you can see that so-called, you know, we think that we are taking a healthy diet, you know, the so-called healthy diet. Actually we are not eating healthy diet. For example, the lunch and dinner is provided today is not a healthy diet. So many are not eating a healthy diet, and even if we think we are, many of the healthy, the so-called healthy foods we are eating have been processed, genetically altered or mishandled, leading to significant loss of their natural nutrient potential. So the way we cook the food is also very, very important to preserve the nutrients and vitamins, and if we don't do that, there is probably a need for replacement. And apart from that, what is happening is that we are, so you can see that agriculture land is shrinking over the years. You can see that especially in the last 50 years or so. I think the agriculture land is shrinking, and the same land we are using for centuries for cultivation, and again we are using pesticides, we are using fertilizers, we use everything so that yield will increase, and genetically altered. So these things, usually what we used to have in a normal usual natural foods, this can become deficient. And that is the reason probably not only in a diabetic, in anybody, there probably is a role for vitamin replacement. Now, if you look into the diabetic, this is one slide I am just showing. There are several such things available, but it's a short topic, so I am just thinking that you could see that there is a possibility of a reduction both in type 1 and type 2 diabetes about the zinc, and then you can see there is a possibility of reduction in magnesium in type 2 diabetes, and there is also selenium is increased in type 1 diabetes, and there is probably not deficient about vitamin B complex, and there is probably vitamin D is also reduced. It can be possibility there actually. This is only thing actually, and not many, you can see that. And off late, you can see that most of the labs are doing B12, and everyone has got high B12 without even replacement of B12. That's what is happening. In the labs we are looking at that. Now, okay, suppose if at all you require a supplementation with vitamins and minerals, what you can do, it should supply daily requirement of nutrients, number one. It should improve the insulin resistance. The reason, very important, it should improve the insulin or increase insulin sensitivity of the tissues with these vitamins and minerals, improve metabolic abnormalities, reduce inflammation, and so that you can prevent complications, both micro and macrovascular disease. This should be the aim of real replacement of nutrients. And some people say that it is cheaper, so that you can think about that. Now, if you look into that, this is the number of molecules that you have where you would like to replace, and you can see a masala preparation happens in the market where they say that we have 82 micronutrients and vitamins in this one capsule, they say. You know, there's so many things. Not only these things, there are so many other things are also available. But what you need to know is that there are certain beneficial and may be beneficial, but not beneficial and harmful as well. Look at this. Be careful about these things. There are beneficial ones such as chromium, zinc, magnesium, alpha-lipic acid, methylcobalamin and vitamin D. And it is not very sure whether they are beneficial, but not harmful definitely. As far as omega-3 fatty acids, coenzyme D, Q10, and beta-melon, fenugreek, aloe vera, they may not be helpful but not harmful. I am not going to touch upon these other things like may be beneficial. I will touch upon beneficial as well as not beneficial, rather harmful molecules. Now, chromium, if you can see that chromium has been found to have an important aspect, especially in the insulin resistance syndrome, and then by replacing chromium over the time, you could see that both fasting and postprandial blood glucose coming down with replacement of chromium. And in a meta-analysis with chromium, we could see that overall estimate, you can see that the chromium supplementation in people with diabetes was statistically significant, and when there is when the HbA1c reduction is much better with chromium supplementation. Frankly speaking, about 2 decades back, chromium came with a big bang in our country, and it went away immediately. See, all these things may be possibilities, but when you really look into that, it may not be beneficial. You should understand. These are all theoretically we can think about that. It came into market and it went away immediately within 1 year. Zinc again is a different molecule. If you look into that, approximately about 0.5% of the crystalline insulin is zinc, and very high or very low zinc plasma content may impair insulin secretion. Very high or very low zinc in the plasma can impair the insulin secretion. Now, where is it you get the zinc deficiency? Is most often happens is because of prolonged glycosuria and diuretic therapy is the time when you can have zinc deficiency, where we can give temporarily about 220 milligrams 3 times daily for some time, and this should be initiated for no more than 3 months, because prolonged zinc supplementation may inhibit copper absorption and adversely affect lipid profiles as well. So be careful. If at all it is there, don't do it too often. magnesium deficiency may result in disorders of tyrosine kinase activity on the insulin receptor and increase intracellular development of insulin resistance. So you can see that both zinc, chromium and magnesium, you could see that these are all involved in insulin resistance only. And then if you can do a lifestyle modification, if you can reduce it, you don't need them actually. And then magnesium deficiency could be involved in triggering of low-grade inflammatory response as well. And about 13 prospective cohort studies involving more than 5 lakh patients and had 24,500 cases detected a significant inverse association between magnesium intake and risk of type 2 diabetes. And there's some association. Again, look at this terminology, association. By replacing, we're improve it, we don't know. There are no studies to state that. Now, this is, I think, probably in neuropathy symptomatic relief, alpha-lipoic acid can be a good choice to be given along with B12 for 6 to 8 weeks, not more than that. And the dose that you need to give is very, very important, because people come and say that I got 50 milligrams alpha-lipoic acid and 5,000 micrograms of this B12 and all. Don't believe in that. We need to give minimum 600 to 800 milligrams of alpha-lipoic acid per day for 6 to 8 weeks along with methylcobalamin to get symptomatic relief of symptoms. That's only thing that we can, especially for those people who are unable to tolerate painful neuropathy, pregabalin. So its side effects may not be there with these two drugs. It's quite safe to be given. Now, I'll finish in 2 minutes. Yeah. Vitamin D, I think you must have known many times. The only thing is association of vitamin D deficiency and various metabolic disorders is well accepted, but whether replacement would improve is not well established. No, it is associated with every disease you name. You name cancer, immune diseases, and everything except rickets. I think everything is so can be considered probably when person has got some musculoskeletal pains, probably. And morning, I think Dr. Sriram Mahadevan was also asking whether is it worth doing vitamin D testing. He said no need, we just replace it because it is cheaper to replace rather than whom to be replaced, those who got symptoms, not everybody. And India, almost everybody has got a vitamin deficiency. I am vitamin deficient, but I am not replacing. I am quite okay. I don't have any musculoskeletal pains. So I think beware of this testing, that everybody goes for vitamin D testing. Patients are coming and asking, I got a vitamin D deficiency, please replace it. So we need to convince them about that. Now this is about the so-called beneficial vitamins. Let us go into the harmful vitamins. Selenium is one of the factor in those days has become a what do you say that a buoyant molecule supposed to be, which is supposed to have pancreatic benefits and increase serum production, and pregnant women, the healthy fetus development, so many things. And later on it is found that you can see that selenium supplementation does not seem to prevent diabetes, rather it may increase the disease. So be careful, don't use it. And then vitamin E supplementation, all of us, you think, you could see that in this heart outcomes and prevention evaluation study investigation, which is published in New England Journal of Diabetes, clearly said that in patients at high risk for cardiovascular events, treatment with vitamin E for a mean period of 4.5 years has no apparent effect on cardiovascular disease, doesn't prevent it at all. In fact, high dose, that is more than 400 milligrams per day, vitamin E supplements may increase all-cause mortality. Look at this, all-cause mortality, and should be avoided. And this is a Cochrane collaboration. It clearly said that very important point that they have said is that replacing with antioxidants such as vitamin E, beta-carotene, vitamin E, and other things together is not going. It's only there is no evaluation before marketing, and then it is more harmful than giving them. So avoid all those things to be given. So that is the reason ADAS came down with a recommendation stating that though there is increased inflammation in diabetes, there is no clear evidence to state that by replacing with the antioxidants like vitamin E or vitamin A and other things, it is not going to. There is no clear evidence sufficient evidence rather to say that replacement will reduce the inflammation. The association is there, but replacement there is no sufficient evidence to say that. So friends, take home messages include that if the balanced diet is deficient in essential nutrients due to decreased absorption and increased excretion, supplementation is needed. And then goal for nutrition supplementation is to improve metabolic requirements so that it will improve the metabolic disturbances, improve immunity and reduce the inflammation. There are beneficial molecules you should recognize, non-beneficial harmful molecules you should also recognize. Please take note of benefits as well as harms of supplements. Thank you for your patient hearing.